I am with Dr. Alessandro Mularoni, Chief of the Ophthalmology Department at San Marino State Hospital, and is the co-organizer, together with me, of this meeting of MEDITERRETINA International Club. So please, Dr. Mularoni.
Thank you, Matteo. I'm honored to be here for this important meeting. It's my first experience in MEDITERRETINA, but I think this is a very special event because it's very different from the other scientific events, and there is something special that we can taste, we can feel in this environment. What about our work in this meeting, Matteo?
We have different sessions, starting from ocular traumatology to retinal detachment, macular surgery, medical retina, medical imaging, and also uveitis and ocular oncology. But also there is a special session called posterior segment meets anterior segments, and anterior surgeons like Dr. Mularoni will moderate this session because it's in the between of retina specialist and anterior specialist. For example,
it's a fantastic program, and is a special session when posterior and anterior surgeons can share their opinion about this important subject with old and innovative solution for the secondary implantation in aphakic patients.
We are at the 11th edition of International Meeting MEDITERRETINA Club. I'm with Dr. Carlo Carlevale from Rome, Italy. Carlo, you just spoke about the news about the Carlevale lens.
Yes, the new model of this lens. This lens is the first sclerofixation customized lens in the world, and there are almost 20,000 implants all over the world. And the new model is hydrophilic, so is it has a wonderful centration, and has been modified, the plug, to have less risk of plug decubitation.
So we are here with Stratos Gotzaridis from Athens, Greece. And please, can you explain us your strategies in a retinal detachment, please?
Yes. First of all, thank you very much for your kind invitation. I would like to thank especially Matteo and Alessandro for being here. Retinal detachment, it's a big topic. I have been doing a minimally invasive technique, which is not to drain the fluid behind the retina at the end of the operation. I try to use as less as possible substances like the perfluorocarbon liquids, and also I try to do the operation as fast as possible in order not to damage the macula. So what I'm doing at the end of the operation, I try to aspirate the subretinal fluid, and if I don't succeed to aspirate all of it, I leave the rest of the fluid underneath the retina and posture the patient from the side of the break. And after that, I do the laser and fill the eye with a gas bubble. And I think I conclude that in a shorter time than other cases do use perfluorocarbon liquids, or they do drain retinotomies.
Thank you very much, Sibel. You presented this topic in ESASO Symposium.
Yeah.
You also are moderator and also your teacher at ESASO.
Yeah.
So can you tell us your experience with ESASO?
Maybe it has been 10 years. We are all together with ESASO. I'm a teacher in ESASO, and it's like a home for us. It's a European School Advanced Studies in Ophthalmology, and it's a great educational platform. It provides many opportunities to young doctors in Europe about the vitreoretinal surgery, cataract surgery, and the theoretical part of it. And they have many campuses, probably the 4 different campuses in Europe and in different parts of the world. It's a great opportunity to join ESASO, and we are very proud of for being a kind of teacher in this team.
I agree. I also teach in ESASO, and me, Sibel, and other colleagues and friends, we are like a family.
Yeah, like a family, definitely.
Really.
So we are here with Ernesto Bali from Bruxelles in Belgium. Please tell us how topics did you present?
So we presented two topics, one on retinal detachment surgery and the use of air. So when we do retinal detachment surgery, we tend to use air, not gas anymore, to limit the tamponade so the patient can recuperate the visual acuity quicker and had to position less, so it's more comfortable for the patient to use air instead of gas. The second topic I presented was on the use of perfluorocarbon liquids, which is used to flatten the retina and chase out the subretinal fluid, and we use perfluorocarbon liquid in a limited way, so to avoid the complications of the perfluorocarbon liquid passing behind the retina during the surgery, which in case of this event, it's always a very dramatical event that can impair the visual acuity of the patient and lead to an unsuccess surgery.
We are with Dr. Antonova Dafina from Sofia, Bulgaria. So are you enjoying the meeting, MEDITERRETINA?
Yes, absolutely. It's a great pleasure to be here. There's a great scientific program with many colleagues, esteemed names in ophthalmology from Europe and also from other countries around the world like Brazil and India. So it's a great pleasure to see and hear some of their presentations and their surgical techniques and ideas.
Thank you. And next year, where will be?
It will be lovely to be in Mumbai next year, so I'm looking forward to it.
See you next year in Mumbai.
See you next year.
So we are here with Gustavo Huning from Santa Maria in Brazil. So Gustavo, can you explain us the special technique you presented here today at this meeting?
Absolutely, yes. So the grinder technique was born in a moment of, of need. I always say that need is mother of creativity. And the sticky oil sometimes is really difficult to work, and when you don't have properly products or consumables, the best way we try to move to provocate a centrifugation process which agglutinated the PFO droplets, and then the oil could come out, and it was inspired in the grinders from the sealing competitions, and that's how it was born.
And this year, Professor Francesco Bandello from Milan is receiving a keynote lecture talking about update in management of diabetic retinopathy in 2022. So, please.
So thank you. I must say thank you first of all, because this is really an honor for me, and I'm grateful to Matteo for giving me this opportunity. So the topic is on the novelties in the field of treatment of diabetic retinopathy. This is one of the most important fields that we have today in medical retina. Medical retina is developing a lot of novelties, and many are in the field of diabetic retinopathy. We have new drugs, we have new opportunities, new modalities of treatment, and many of them are able to improve a lot the prognosis for our diabetic patients. I think that the future will be really a lucky time for our patients compared with what we had before. We are having drugs that are able to stay inside the eye for a longer time. We have more efficient drugs. We have longer duration drugs. We have everything. And I hope that in the next few years we will have these improvements available in clinical practice in order to guarantee that our patients will be able to spare vision for longer time and forever possible.
So we are here with Mohamed Khalife from Beirut in Lebanon. So can you please summarize how to treat foreign bodies, intraocular foreign bodies, please?
Thank you for that. It's my pleasure to be at the MEDITERRETINA this year, 2022, in Rimini. And usually the foreign bodies and the ocular trauma is very important to us. We usually go after primary repair, and they are referred to us either in the first place or after a primary repair by a general ophthalmologist. Then our work starts as a vitreoretinal surgery, We do the vitrectomy and we clean the eye from every vitreous hemorrhage or other hemorrhages, and then we go for the foreign body removal. In most cases, in some cases where we have inert foreign bodies, such as the glasses or something like that, we can postpone the vitrectomy later, especially if the cases are not vision acuity threatening cases. And we do after that the follow-up, and then everything goes okay. With the machines today, with the vitrectomy machines today, we have a good visual acuity, and not like before. The patients do well, and we are happy to share this our experience in this field with our colleagues, especially here in Italy and all the world.
We are here with Dr. Camburu Georgiana from Bucharest, Romania. And what's your opinion of this Congress?
First, I want to thank you for the invitation to this great Congress. It's an honor for me to be here. My opinion of this Congress was that it was 2 days full with up-to-date topic presentation made by the top specialists in this field. So an awesome experience.
Oh, thank you very much. Your presentation was very good, was cited by the European Glaucoma Society this year.
Yes.
Can you tell us which topic is about?
My presentation was during the uveitis section, and the topic was about hyphema, uveitis, and glaucoma plus syndrome. And it's true that it was quoted by the European Glaucoma Society as tip of the year in this month in June.
Congratulations.
Thank you very much.
And next year, MEDITERRETINA?
Of course, we see each other next year in Mumbai. Yeah, it's an awesome location to discuss retina.
And
so,
not only
retina.
Thank you very much.
Thank you also.
Thank you very much.
So we are here with Andrea Govetto from Milan, who presented a study on macular hole. Please, Andrea.
Yes. Thank you, Camilla. So yes, this study was important because we explain how the photoreceptors degrade in full thickness hole. And this is very important to give a prognosis to our patient, to know which patient will do good and which one will do bad after surgery. So basically we describe specific morphologic changes at the base of the hole which relate to surgical prognosis. And the work was just published on the American Journal, and I hope you will read it. So this was really a fantastic meeting, and thank you so much for inviting me.
Thank you, Andrea.
It was a pleasure to be here.
We are with Agnieszka Nowosielska from Warsaw, Poland. Can you please summarize us your management of submacular hemorrhages using TPA?
Submacular hemorrhages remain a great problem, even in the era of anti-VEGF treatment, because they cause very severe damage for the central vision. My management is to perform early vitrectomy with subretinal TPA, which resolves the clot of the blood and pretty much allows to restore vision.
Thank you very much, Agnieszka.
Thank you.
We are here with Professor Arne Viestens from Halle, Germany. And so please explain us something about your topic today, the topic you treat today.
Thank you. So the idea is we have some patients who will not respond to intravitreal injections in diabetic macular edema. The question is why? It's because of ischemia. The patients suffer sometimes from a non-perfusion in the central part of the eye, and we introduce a technology of ILM peeling in comparison to intravitreal injections in patients with visual acuity which is less than 0.3. And we have a fantastic method to improve the reperfusion with vitrectomy and ILM peeling in the diabetic macular edema patients. Thank you.
Thank you.
Thank you.
I'm with Dr. Anna Zanardi from Biella, Italy, and she's presenting a new technique using Dormiano tip for intraocular foreign bodies removal. Please, Anna.
Young patients came to our attention with a fission sinker in vitreal chamber. I removed it with Dormiano tip, commonly used in urology. The instrument, 25 gauge, is easy handling and it fits all sizes of foreign bodies.
Thank you, Anna. You also presented another technique called the sewing technique.
Yeah.
In which cases is it useful?
The sewing machine is a closed chamber technique for wide iridodialysis. It's really easy handling, really fast, and it's really useful for wide iridodialysis repair.
Thank you very much. So both these techniques are very useful in severe ocular trauma and requires a fast procedure,
with
low cost, very important in public hospital.
Yeah, and you can fix the iris of the patient.
Yes, very nice.
You don't need
prosthesis.
Yeah.
So you don't need additional prosthesis and use original tissue.
Yes.
Thank you again. It's just finished the 11th edition of MEDITERRETINA Club International Meeting from Rimini, and I'm with Professor Sundaram Natarajan from Mumbai, India. He will be the next organizer of next edition of MEDITERRETINA in 2023. Please,
Thank you, Matthew. It's a great honor for doing the 12th MEDITERRETINA Club meeting, international meeting in Mumbai, India in November 2023, because I've seen Matthew as a small kid from 90s, and I know Cesare Forlini from the late 80s, along with Dr. Relja Jovanovic, and it'll be a great honor to host this meeting and have an introduction about both Relja Jovanovic and Dr. Cesare Forlini, who taught pole-to-pole surgery in India. And I think Cesare has visited 7 times or 8 times to India, and every time to Mumbai, my clinic, and to many meetings in India. And Cesare Forlini is very popular in India, and many people follow his technique even today. So it will be a great honor, and I am hopeful that we'll also include live surgery, where Cesare Forlini always wanted to do, and probably we'll start with Matthew in the live surgery also in the meeting, and make this meeting, even though it's a club meeting, but we'll make it grand one great grand one in India.
In your country, in your city, Mumbai, which one are the most developing fields in ophthalmology? With maybe diabetes or?
Yes, unfortunately, India is becoming the capital of diabetic retinopathy in the world. So, me from my clinic have made a unique work of using mobile phone to use offline AI to screen diabetic retinopathy, so that we can prevent complicated diabetic retinopathy. In spite of that, I'm going to talk now on 3D vitreous surgery for proliferative diabetic retinopathy, which is the most complex problems in the world we face, because many people don't undergo laser, don't get injections, directly come with vitreous hemorrhage and traction detachment. I see the same problem in Mexico. Last week I did a live surgery on diabetic retinopathy, the most complex traction detachments, which I did a 3D. So that's what I think I've done, one of the maximum number of vitreoretinal surgery for diabetic traction retinal detachment. In spite of that, my aim is to do screening and prevent it, but I know we will keep facing this complicated problem, and we are having excellent surgical techniques in India with the bimanual and also the wide angle, and also using the 3D, I hope to combat the diabetic blindness.
Thank you very much, Professor Natarajan.